So I often tell my patients that it's going to be frustrating and it's going to take time to find the right skincare regimen for them that won't trigger their eczema. But once we find it, it'll be completely worth it because they'll get relief for the rest of their life and they'll know what to avoid to reduce the number of flares. I often will tell my patients to look for products that are fragrance-free. For example, you may want to experiment with certain laundry detergents that are going to be fragrance-free, or anything that you're applying to your face or body. Having heavy amounts of fragrance can be a trigger for some people with eczema. One of the things that can really trigger your eczema is taking long showers. And I understand people like to relax in the shower, they want to sing, they want to get their thoughts out, but the longer you stay in the shower, particularly when the water is hot, the more likely you are to dry out your skin. And so you want to take short showers with lukewarm water. The other thing I tell my patients is to avoid using any kind of harsh scrubbers or big exfoliants in the shower because it might actually be irritating and drying out their skin more. And afterwards, then you re-moisturize your skin. If you have eczema and you're using a lotion but still feeling dry, you may want to consider using a cream instead. Lotions are nice and they're lightweight, but creams have a thicker consistency, and so people with eczema may prefer that so that they can retain a little bit more moisture in their skin. Many patients find the itch to be very bothersome, and hence it's very tempting to scratch it. I understand. However, I like to emphasize to my patients that scratching the rash is actually just going to make it worse. And that's because there's something called an itch-scratch cycle. The more you scratch, the more you itch, and then you just end up in this violent loop. So you want to use things that are going to help relieve that itch and reduce the risk of you scratching so that you're not continuously perpetuating the cycle. As a dermatologist, I work closely with my patients to educate them about some of these habits that may or may not be triggering their eczema, and then of course to give them medications if needed to get them through some of their intense flares. If we can work out your triggers, we can help manage the flares and of course reduce the number of flares that you get.